Lawmaker and doctor has a new bill banning time limits on an essential surgical treatment. Selah Still spoke with him and a health professional. She has more on this story.
The Illinois General Assembly has a new bill to consider, which would make it illegal for insurance companies to place a time limit on coverage for anesthesia, even during surgery. The insurer Blue Cross Blue Shield tried to do this in Missouri last month, for example, and then quickly backtracked. Republican state lawmaker William Howder, who is also a physician and anesthesiologist, says putting a time limit on coverage for an operation is dangerous and unethical because surgeons and patients have little control of the operation length due to things like abnormal anatomy or other factors.
There's an incentive to finish in a certain amount of time that the insurance company says is appropriate. And so therefore, are you going to rush the surgery? Or is there going to be any complications that you don't foresee? Is there going to be maybe equipment problem?
The surgeon-in-chief at OSF says several factors make up the time length and dose of anesthesia given to patients.
The duration of that time, the time that a patient spends in the care of the anesthesiologist, is a function of the complexity of the operation, the complexity of the patient, what their other medical, we call them comorbidities, but what their other medical issues are like.
We reached out to Blue Cross Blue Shield of Illinois, and a spokesperson answered in an email. While we do not comment on pending or proposed legislation, Blue Cross Blue Shield of Illinois did not propose time limit changes to its anesthesia reimbursement policies. Each Blue Cross Blue Shield makes its own medical policy decisions. Selah Estelle, 25 News.